In this video, you'll get a quick overview of Vibrant's Neurotransmitters Test. I'll explain the Vibrant advantage and the technology used. Then I'll walk through each section of the test, highlighting key features. I'll also suggest complementary tests and end by summarizing the key takeaways and where to go for additional information. Neurotransmitters are endogenous chemical messengers that are secreted by a neuron in response to an electrical signal. They cross a synapse to communicate with another cell, such as another neuron, gland, or muscle cell. Neurotransmitters are involved in many physiological processes in the body, from regulating mood and heart rate, sleep regulation, digestion and appetite, muscle movement, breathing, learning, memory, motivation, pain, and many more functions. Understanding these essential chemicals provides critical insights into managing mood disorders, improving mental clarity, and supporting overall wellness. Vibrant's Neurotransmitters Test is a non-invasive test that provides a snapshot of an individual's specific neurotransmitter levels, measuring levels of the most common neurotransmitters and metabolites in the brain and nervous system. This includes inhibitory, excitatory, and other neurotransmitters, along with diurnal rhythm of epinephrine and norepinephrine. This test provides insight into how the nervous system is communicating. Vibrant's Neurotransmitters Test is an easy at-home urine test. Patients collect their first morning urine 2 hours after waking, and then an evening and night sample. There are no supplement or medication restrictions. However, patients should avoid pineapple, nuts, alcohol, protein powders, and protein shakes 48 hours before collection. Vibrant uses liquid chromatography tandem mass spectrometry methodology, or LC-MS-MS, for quantitative detection of neurotransmitters. Liquid chromatography with tandem mass spectrometry is a powerful analytical technique that combines the separating power of liquid chromatography with the highly sensitive and selective mass analysis capability of quadrupole mass spectrometry. In fact, mass spec is the gold standard for the detection of small molecules. Before we dive into the actual report, I want to remind you that you get to choose how much information to include in the report you download for yourself or the report you share with your patients. You have 3 options: summary, interpretation, and all markers. I'll be going over the report that includes all 3 options combined, as it is the most comprehensive. Let's start with a quick overview. The neurotransmitter sample report includes a cover page, introduction, summary with interpretation plus graphs, and then lists all markers. The cover page lists the sample type and results interpretation key. The introduction page includes the methodology and interpretation of report, and I highly recommend reading this page, especially the part where it says, "The Vibrant Neurotransmitters panel uses tandem mass spectrometry methodology for quantitative detection of neurotransmitters in urine samples." And also the part where it says, "Reference ranges have been established using a cohort of 1,000 apparently healthy individuals." And also the part where it says, "The classification of red indicates the result that is outside the reference range, and the classification of green denotes result that is within the reference range." The summary shows the markers outside of the reference range along with an interpretive comment. For neurotransmitters, this includes markers that are too high as well as too low. The summary also shows diurnal rhythm graphs for norepinephrine, epinephrine, and urinary creatinine. And then the full report lists the levels of all neurotransmitters, including excitatory neurotransmitters like glutamate, histamine, and dopamine, inhibitory neurotransmitters like serotonin, GABA, and taurine, other neurotransmitters like tryptamine, tyrosine, and 5-HTP, along with ratios and the data for diurnal graphs, including urinary creatinine, diurnal epinephrine, and diurnal norepinephrine. The results are populated as both a number and plotted graphically so you can visually see how high or low your patient's results are. In this example, 3-methoxytyramine is within the reference range, but 5-HTP is elevated with respect to the reference range. If you want to learn more about the neurotransmitters that are outside of the reference range, simply scroll back to the report summary and read the interpretive comment. You can take an even deeper dive by checking out the Neurotransmitters Interpretive Guide in your provider portal. One last thing to point out is that all urine tests should also measure urine creatinine. This is because urine can have varied concentrations. Sometimes it's a pale yellow and sometimes it's an orangey brown. Good news, urine creatinine is constant. So, all neurotransmitter levels are normalized to urine creatinine to account for urine dilution variations. So, which patients benefit most from this test? Well, patients with mood disorders like depression, anxiety, or bipolar disorder, also behavioral disorders, addiction and dependency, poor mental focus such as brain fog, poor attention span, also migraines, gastrointestinal dysfunction, hormone abnormalities, adrenal dysfunction, fatigue and insomnia, cravings or loss of appetite control, as well as weight gain or weight loss. Before we talk about complementary tests, I want you to think about Dr. Sidney Baker's TAC rules. Rule number 1. If you're sitting on a TAC, it takes a lot of aspirin to make the pain go away. In other words, it's difficult to heal if you don't identify the root cause of your symptoms. Rule number 2. If you're sitting on 2 TACs, removing one does not necessarily result in a 50% improvement in symptoms. In other words, sometimes there's more than one root cause contributing to your symptoms. In addition to the neurotransmitters test, consider the micronutrient test, as many enzymatic reactions for neurotransmitter synthesis require nutrient cofactors. Therefore, it's extremely helpful to have information on nutrient levels when interpreting the neurotransmitter test. The most important micronutrients involved in neurotransmitter pathways include vitamins B1, B2, B3, B5, B6, folate, choline, iron, magnesium, copper, vitamin C, vitamin D, and amino acids. Also, the gut zoomer to assess for impaired digestion and malabsorption, which could lead to decreased amino acids and nutrients required for neurotransmitter synthesis. On a similar note, the methylation panel to assess for impairments in the methylation cycle affecting neurotransmitter synthesis. This is important since many neurotransmitters rely on methylation support for either synthesis or degradation. Additionally, the Neural Zoomer Plus to assess for antibodies to different neurotransmitter receptors. Also, the total tox burden to assess for toxins that may interfere with neurotransmitter synthesis, receptor function, and neurotransmitter metabolism. Additionally, hormone tests to assess for hormone imbalances since hormones can influence many neurotransmitter levels. And finally, the wheat zoomer to assess for gluten sensitivity that may affect the glutamic acid decarboxylase or GAD enzyme, affecting glutamate and GABA levels. In summary, Vibrant's neurotransmitters test uses gold standard LCMS-MS methodology to measure levels of the most common neurotransmitters and metabolites in the brain and nervous system, including inhibitory, excitatory, and other neurotransmitters, along with diurnal rhythm of epinephrine and norepinephrine. Since many treatment recommendations used with neurological or mental conditions are currently guided by a general diagnosis or a, quote, trial and error approach, the neurotransmitters test can provide clinically useful data to help guide monitoring and managing of neurological or mental health conditions. It can also be used to assess medication efficacy and responsiveness or help wean medications or supplements. To learn more, visit the link in the video description. If you have questions, please ask them in the comments below this video. Thanks for watching, and I hope you have a vibrant day. Vibrant's neurotransmitters test is an easy at-home urine test. Patients collect their first morning urine 2 hours after waking, and then an evening and night sample. There are no supplement or medication restrictions. However, patients should avoid pineapple, nuts, alcohol, protein powders, and protein shakes 48 hours before collection.